It's been a long time for those of us, doing child health policy work, just being together, particularly in the city, but also elsewhere. I want to welcome everyone and thank you for joining us for the PolicyLab Forum 2022, which was originally scheduled for 2 years ago.
One of the things that we've seen over the past 2 years of pandemic is both a focus on the needs of children and families, but at the same time a marginalization of the needs of children and families. And I think that there really has never been a more important time than now to refocus on what children and families really need to thrive into the future, and how we support that.
Policy space, this has been a slow change, but families have been reacting to this, and that's something that our own research at PolicyLab has been able to take a look at the decisions that families have made.
Well, I think this is a great opportunity to continue to talk about so many of the issues affecting, for us, we're going to be talking about healthy moms and strong babies and what needs to change in the policy environment in order to better address so many of the challenges that families face, that moms face, that pregnant people face, children, and we're happy to be with a bunch of partners that want to engage on these issues.
As policymakers, again, we don't come up with all the ideas. We don't have all the lived experiences. We're not in the day-to-day of this work. And these type of conversations bring advocates, community individuals, experts, physicians, doctors. It brings us all into a room to talk about what's working, what's not working, talk about our successes, but also where do we need to pivot next. So, that's one of the reasons why I think these, conversations are just priceless. I mean, throughout the entire conversation, I'm like taking notes. Okay, we need to do this. This is our next steps. And it only can happen when, CHOP and, through PolicyLab, puts these conversations, and in these rooms do we come up with great ideas that can really move Pennsylvania forward.
I hope that just by bringing state, federal policymakers together, researchers, my hope is that people go back to their respective localities, states, energized, new ideas, able to push policymakers and legislators, because again, there's a really dynamic space right now in social policy, how that intersects with health outcomes. I think that can be a big motivator for why these investments matter, investments in children and families. So that's my hope.
We couldn't host a Children's Health Policy and Practice Forum without involving the youth themselves. These individuals are leaders within their communities, advocating for all youth and inspiring those around them. They envision a healthier, more equitable world.
It was a long day and a half because there was so much to catch up on. And I think it was energizing for a lot of people just to reconnect. It's been a long time since a lot of people, even in our own center, have seen people in person. And we just had, some of our heroes here. We had a broad spectrum of opinion to really open our eyes to what we just went through and then what lays ahead for children and families. And we couldn't be more thrilled with the turnout, with the people who showed up, and what we learned and the new connections we made. And so if this inspired some of the seeds of those relationships and the ripple effects of how we're going to proceed in terms of at the states and also at the federal level for change for children and families that benefits them, then I think we've succeeded.